Okay guys, this is 8th part of series of this pharmacology. In this part we are mainly focused on antidotes of causative drug. Let's get started. First antidote is N-acetylcysteine. N-acetylcysteine is used as an antidote for acetaminophen overdose. It contains sulfhydryl groups, which bind to and inactivate NAPQI. Best results if given within 8 to 10 hours of overdose. Follow liver function tests and acetaminophen blood levels. Next antidote is Atropine. It is used as an antidote for cholinesterase inhibitor poisoning, for example, nerve gas, insecticide. There are different use of atropine besides overdose like treatment of bradycardia during cardiac emergencies, also used to treat urinary incontinence and also as an ophthalmic solution to produce mydriasis for retinal examination. Atropine is a competitive muscarinic, M1, M2, M3, receptor antagonist. It is useful for control of muscarinic symptoms. Next antidote is pralidoxime. It is used in conjunction with atropine to treat organophosphate poisoning. Pralidoxime can also be used to treat overdoses of acetylcholinesterase inhibitors like neostigmine or physostigmine. Pralidoxime acts to reverse cholinesterase inhibitor activity. Side effects of pralidoxime are flushing, tachycardia, dry mouth, blurry vision, sedation. Next antidote is physostigmine. Physostigmine is another reversible acetylcholinesterase inhibitor. Since it is able to cross the blood-brain barrier, it can be used to treat atropine poisoning. It is also used as an ophthalmic solution in the treatment of glaucoma, as it can produce miosis and stimulate the outflow of aqueous humor from the eye, thereby decreasing intraocular pressure. Next antidote is flumazenil. Benzodiazepine overdose is characterized by cardiac and respiratory depression. It is treated supportively and with flumazenil. Is a competitive antagonist of benzodiazepines at the GABA receptor. Benzodiazepines should be used with caution in patients who use alcohol, barbiturates, or other CNS depressants as well as in patients who have liver disease. Next antidote is ethanol. Ethanol is used in the treatment of ethylene glycol and methanol overdose. Ethanol acts as a competitive substrate, thereby decreasing the metabolism of ethylene glycol and methanol and thus decreasing the formation of toxic metabolites. Ethanol is also a drug of abuse. Long-term alcohol use can lead to alcoholic liver disease with eventual cirrhosis, portal hypertension, renal failure, and encephalopathy. Next antidote is sodium bicarbonate. Overdose of tricyclic antidepressants and quinidines are treated with sodium bicarbonate to prevent life-threatening arrhythmias. Overdose of a TCA is associated with ECG changes like widening of QRS complex, cardiac arrhythmias, mental status changes, and seizures. So it usually reverses cardiotoxic effects like wide QRS, hypotension. Give cautiously in heart failure because it may cause sodium overload. Next antidote is naloxone and naltrexone. Naloxone and naltrexone are used to treat opioid overdoses. Both are specific antagonists of opioids receptor. It may have to be repeated when treating overdose. Next antidote is hydroxycobalamin. Hydroxycobalamin is used to treat cyanide overdose. It converts cyanide to cyanocobalamin, vitamin B12. Next antidote is glucagon. It is clinically used as beta blocker overdose. It reverses hypotension and bradycardia. Thanks for watching. If you like video, hit subscribe and share the video.